Okay, so now this is the low-level patient segment. Whether they're low-level, low trunk control, don't have a lot of strength, first time you're going to try to stand them up, all of those. Now, what we've got here are different pads. This here is called chest plate. This one's called the knee board. For low-level patients or low trunk control, we're going to use the chest plate, okay? Now what you do is you just pick it up just like that and you slide it in all the way over. It'll slide in the other transfer bar and you go down with it. Pull the Velcros out of the way and then just go ahead and tie them up. Now I'm going to bring the pad next to the patient. What you want to do is you want to touch the knee. You do one at a time. You don't try to do both of them. Okay. Now, this is really, really important. There's two ways to stand the patient up. A low level, when you're doing 100% assistant, and then there's also whenever they're doing a sit to stand. That'll be another segment. But there's a different way of setting the patient up for both of them. What we're going to do now with Corey is 100% assistant, low-level patient, okay? So I'm going to raise the table so that its heel is about 1.5 inches off the floor. Now this is really important. Also, we want to make sure that the patient is sitting all the way back on the table. So we want their knees to be touching, the back of the knee touching the table, okay? So that's what I'm making sure here that he is. So now I'm going to go ahead and touch his knee with the pad. I'm going to lock the transfer bars. And again, with the heel 1.5 inches off the floor, I'm going to stand in front of him. We're going to have the patient hold on to the bars. And what I'm doing right now is the seat is coming up. I've got control of the table right here on my thumb. I do everything right here. Now I'm standing in front of the patient so that I can hold him because he's a low-level patient, low trunk control. As you're standing the patient up, you do want to talk to them. Let them know what you're doing, what's going on, and if they feel any discomfort at all. Okay? Sometimes, as you're putting them up, if the patient is really sensitive to their knees or anything, you can actually stop. You can unlock the transfer bar. It's not going to fly out, and you can actually let it slide out a little bit and lock it in place again. This is if they're saying anything about too much pressure on their knees. Okay, that's one of the things you want to watch. The other one is if you have a gap in between the bottom of their leg here, their thigh, and the bed itself, or the seat, you want to raise the bed a little bit, like so, to take care of that, so that they have full support under their leg. And then you may continue. You may have to do that once during the standing procedure. Now as the seat comes up, the seat will stop at 70 degrees. Okay, right there. Corey is standing. I didn't have to pull on him, pull on the gait belt, or really do any physical work. Just right here with my thumb. Once you have the patient up and standing, you can then do different activities with them. You can bring an eating tray over. We can do all kinds of different activities. Why don't you mark number 25 and 23 for me? So this allows you to do some OT work as well. You can have an E-stem at the same time they're standing. The hands-free environment that is created by the Berryhab allows me to be able to do different activities with the patient without needing any standby by another physical therapist. So it's quite safe. Once you've stood him for a while, you want to sit them back down. You're just going to reverse the procedure. I'm going to hold on to them, tell them that you're lowering them, make sure they're not feeling any pressure. Now we've got 3-inch high density foam here, so there's a lot of foam here and it's pretty soft.